Lindsay, if you have a bladder problem, there are things that you can do to correct it. And right now, we have Dr. Karen Delhey, who is with the Houston Metro Urology office here. And, wow, a lot of folks do have bladder problems, but it's because of age, isn't it?
Yeah, as we age, more and more people develop overactive bladder. It affects probably a third of people as we get older. Overactive bladder is something that is frequent. It can be just that you're drinking too much. So sometimes people think drinking a lot of water, great. Not necessarily.
Really?
I mean, you ought to drink about 60, 70 ounces a day, but if you're drinking 200 ounces a day, you're going to pee frequently.
Okay.
And so that's not a problem.
And what about some of these other things? Because I know I like V8, but you kind of told me that that's not really one of the best things to
That's
drink.
right. Tomato juice, orange juice, acids can irritate the bladder.
Coffee?
Caffeine is a big irritant from the bladder. Now, if it's worth it, go ahead and have it. You'll just have to pee a little more often. Cokes and artificial sweeteners, big irritant for the bladder.
So what do you do to control an overactive bladder?
So the medicines have been out for a long time. The problem is the medicines work, but about only 80% of patients stop the medications. And so what do you do? After a year, only 20% are still on medications. This is either because they're too costly or they have side effects. Dry mouth, blurred vision, constipation. So things that you can do: cut down on the liquids that you drink. You can keep a diary, and what you're going to do is just see how much your bladder holds. The normal bladder holds 10 to 15 ounces. If you're holding 4 ounces, you've got a problem.
All right.
So we try the medications. If those fail, there are 3 other things that you can do.
Real quick, we're running out of time.
We can do Botox into the bladder. You can do tibial nerve stimulation, which is a quick outpatient, or just in the office. Or we can do sacral nerve stimulation, which is an implant in the bladder. So call your local doctor. You can see a urologist, and we can help you.
All right. Thank you so very much, Dr. Karen Delhey with Houston Metro Urology.